You're turned on, you're having sex, things are going great, but suddenly you lose your erection. That moment leaves you feeling embarrassed, frustrated, and maybe even avoiding intimacy. You're not alone. Let's break down exactly all this happens and what you can do, all backed by the latest science. First, here's how an erection actually works. It starts in your parasympathetic nervous system, your rest and digest mode. Nerves and blood vessels release nitric oxide, relaxing arteries so blood rushes into the spongy corpora cavernosa. Veins trap the blood, creating firm pressure. Any problem in this flow, unhealthy vessels or leaky veins, makes it hard to stay firm. Here are the 6 most common reasons men lose their erection mid-sex, even when it starts strong. Reason 1, an underlying vascular or hormonal issue. This is the #1 physical cause. The 2024 Princeton IV Consensus Guidelines in Mayo Clinic Proceedings call ED your body's check engine light for heart disease. Penile arteries are tiny. Problems show up here first, years before heart attacks. Men with ED have double the cardiovascular risk. That's why this early warning is so crucial. High blood pressure, cholesterol, diabetes, and low testosterone damage vessels silently. Get checked. Morning testosterone blood test too. Reason 2, your brain isn't cooperating. Your brain is the most powerful sexual organ. One slip triggers anxiety. Fight or flight mode constricts blood vessels and pulls blood away. It becomes a vicious cycle. Break the cycle. Talk to your partner, try sensate focus exercises, or see a sex therapist. A low daily 5 mg dose of tadalafil often gives the confidence boost you need while you rebuild trust. Reason 3, decreased tenile sensitivity. As we age, nerve endings send weaker signals to the brain. Switch things up. Use vibration toys, warming or cooling lubricants, or light heather touch. Novelty helps. Reason 4, you're just not fully aroused. You're not a machine. Peak mental and physical arousal is needed. Add more foreplay and novelty before penetration. Rushing keeps you at only half strength. Reason 5, medication side effects. SSRIs, beta blockers, older antihistamines, and finasteride can affect erections. Never stop meds or our own. Talk to your doctor about alternatives or adjustments. Sexual health matters. Reason 6, sleep apnea, one of the most underdiagnosed causes. Oxygen drops at night, spikes stress hormones. This narrows vessels and lowers testosterone. CPAP therapy improves erection scores in major studies. As you can see, the data shows a clear and significant improvement. Risk factors include a neck over 17 inches, snoring, daytime fatigue, and if a partner notices breathing stops. It includes neck measurement that shows snoring waves, tired eyes, and breathing cessation. A simple home sleep test can diagnose it. Treating apnea helps your erections, testosterone, heart, and longevity. Bottom line, losing an erection mid-sex is common. Understand the cause so you can fix it. Don't suffer silently. See your doctor or urologist. You deserve a fulfilling sex life again.